Hey guys, so I think good evening. I think the counseling is almost started right now. So it's a great pleasure to have with me Saurabh and Sham. Saurabh is a KE is a resident in cardiothoracic surgery at KEM, and Sham is a thoracic surgery resident at Gangaram. So today is going to be a pretty open session. I would like Saurabh to start, and Saurabh, you can just start talking about how the field is and what are the opportunities you need to look at, what are the choices you need to make, what are the things that you need to do before making a choice. You can comment on individual institutions if you have a knowledge. Same goes to you, Shyam. You can talk about the field of thoracic surgery. What is the scope? What kind of surgeries do you do? And what is the basic minimum exposure you require in every institute? So we don't want surgeons getting into the wrong institute, despite having a great rank where they are not allowed to operate, where they don't have basically exposure at all. So that's not something which we want. And yeah, so Saurabh, you can go first. I'll be muting.
Okay,
Yeah.
okay. So, hi everybody. First of all, congratulations on getting a rank which you wanted uh, through the NEET SS. And first of all, I'd like to say this. I want this to be a very open-ended, didactic kind of thing in which you shall ask me questions. Anybody who's wanting to ask any questions can ask us questions at any given point of time. I'm sure Sham will agree for the same.
Yeah,
And
so
yeah, perfect. And so starting from the basics, so as you know, CVTS is not one of the first choices which residents make, but I think this is a big mistake because looking back at my 3 years of my residency, now that I'll be finishing my residency in the next coming 6 months or so, but the scope of CVTS, what it has, and the amount of exposure that an individual can get during residency is unremarkable. Secondly, cardiac surgery, people say it's a dying branch, this, that. I'll say absolutely it's wrong because, and people say, yeah, one more thing that, cardiologists are taking up all the cases nowadays. Nothing like that. Because I'll tell you one thing, where the cardiologist's scope ends, your scope begins. So you give backup to all the cases which cardiology does. And for the same reason, cardiac surgery is a definitive answer. Cardiologists performing intervention is not a definitive answer. It is one of those things in which, if suppose the plants are turning yellow, so you have two options: either paint the leaves green or water it. So cardiac surgery is basically watering the plant, going to the root cause and dealing with it there and there itself. Moving on, what as Vinayak sir asked, second thing is what are you looking for? So I would recommend what you should actually look for in a college is: number one, is it in the state in which you want to practice moving forward? Number two, what is the bond like? Number three, what is the stipend like? And number four, do you get any cutting, or how is the exposure like? And lastly, what is the toxicity like? Because at the end of the day, it's a surgical branch. There will be institutes where toxicity will be a role, and you want a good amount of healthy balance between your family life and your personal life, because and your work life, sorry. So because at the end of the day, you're all above, say, 28, 29 at this point of time, I'm guessing. So you have to have a good family life and a work life balance. So that is also one thing which all of you should look at. Cardiac surgery per se, I think Sham would like to talk more about thoracic part of it. But cardiac surgery for me, if you ask me personally, I would say it. Even though we call it as CVTS, it's innately distinguished into cardiac surgery and thoracic surgery at this point of time. Without even us, talking about ki okay, CVTS ka degree milta hai, but how much of thoracic do you actually do in CVTS? That's another question. But if suppose I have to go to if I have to get operated for, say, a lung pathology or something like that, I'd rather go to a thoracic specialist than a CVTS, because a thoracic specialist has done more number of cases in thoracic surgery than a CVTS individual. So if you want to exclusively look for cardiac, then yes, CVTS is for you. If you want to look for say thoracic and will with a good exposure thoracic, I would recommend you going for what Sham is going for. You know, like a proper thoracic course. So that will give you a great idea between differentiating idea between cardiac and thoracic. So even though we say it's a CVTS, it's no longer just it's no longer just the entire spectrum of CVTS. It is more or less nowadays distinguished between whether you're doing proper cardiac or you're doing proper thoracic. And eventually, say within the next 5 years, I'm guessing there will be a division of pure cardiac and pure thoracic. So moving on forward, I think you have to predefine your notion that what you exactly want to do. You do you want to go into cardiac or do you want to go into thoracic? Because you will not have both. Lastly, there are colleges which will give you exclusively vascular. That is also a good option, but again, you have to know what is your future in it. What all cases you're gonna get in purely vascular, because vascular, although there is a need of vascular surgeons per se, but moving forward, I don't know what is the scope per se, because cardiac surgery handles a good amount of vascular cases. VIR handles a good amount of vascular cases also, and neuro intervention can also handle a lot of vascular cases. So moving forward, it's like vascular can be dealt with a number of different branches, but thoracic per se, a thoracic specialist only can do it, or a CVTS can do it if he has good exposure. And likewise cardiac, only and only and only cardiac surgeons can do the best job when it comes to this thing, dealing with a cardiac case. Moving forward, you're going to have more of super specialty kind of picture. uh, uh, Shivani, I'll get to you. Shivani, I'll get to you your question. So moving forward, so it's going to be like a something like a super specialty, or something like fellowships in different branches. For example, if suppose somebody is interested in doing pediatric cardiac, so that they can go into pediatric cardiac surgery. So the spectrum of diseases there will be your congenital diseases, complex congenital surgeries, your arch diseases of the congenital spectrum, and so on and so forth. So that is how you have to deal with at this point of time. This is what you want is first to jot it down, which city you want it, what is your salary expectations, or stipend expectations, what is the bond like, are you willing to give another 1 or 2 years of your bond to that institute or that state. So this is all what you should keep in mind, that your state, your rank, your stipend, the cutting which you're getting, and is there not any toxicity per se in that department. And moving on, yes, like you said, there are different colleges that will offer you different things. So you have to make a list of all the colleges who are offering you what all things. And cardiac surgery or thoracic surgery or vascular surgery, that you have to define yourself. And lastly, I would like to say that you talk to every individual from colleges which you are targeting. It will give you a better idea. Also, it helps a lot if you go and visit those hospitals. It's not going to take a lot of effort visiting these hospitals, because you go to a city, suppose you go to Delhi, you go to 3 4 hospitals in the same area, or whichever hospitals you're targeting. Then you come to Mumbai, you visit say KEM, JJ, Nair, Sion, and so on and so forth. So that is how you make a firm decision of what you want to do. You make a choice of what exactly are the things which you are targeting. And yeah, that's it. I mean, the spectrum of if I have to talk about cardiac surgery per se, the spectrum goes from congenital cardiac surgery, that is your ASDs, VSDs, your PDAs, then to your valve cases, that's your mitral aortic double valve replacements, your tricuspid valve. Then it goes to coronaries, that is your CABGs, and lastly, you have your aortic diseases. So this is the entire spectrum of cardiac per se. I've just given you a brief idea about it. Thoracic, Sham, I think, will enlighten us more about the thoracic part of it. Vascular, again, like I said, vascular, you can do a lot of embolectomies. You have a lot of scope for interposition grafting, and a lot more to do actually. So, coming to the hospitals, I think I'll let Sham talk about thoracic first, and then I'd like to come back to hospitals in Mumbai, which I'm very familiar with, and the hospitals for CVTS in the country. So
Yeah.
that's how I think we'll go about it. Like I've given you a brief about what cardiac surgery is and what all should you target in the next coming few days. And then you can, after this, I think we'll let Sham talk for a while about the spectrum of thoracic diseases. And then we can come back to me about what hospitals you should target if you're in, say, Delhi, Mumbai, or anywhere else. So I think that sounds good. I think, Sham,
Yeah.
can you take over, please?
Thanks for the brief introduction, Dr. Saurav. So I'll introduce myself. I'm Dr. Shyam Rengan. I'm doing second year in Gangaram Hospital. This is exclusive thoracic surgery. Unfortunately, even many people do not even know that there's a separate department called thoracic surgery. And the need arises, the split, I mean, the need arises for the split of the very three departments, that is cardiac, thoracic, and vascular, is because the scope in each field is very vast. For example, even in cardiac surgery, you have people who deal only with valves, people who deal only with coronary vessels. So cardiac itself such a vast field that a person, it's almost impossible for a person to do complete cardiac work and do thoracic work and do vascular work. So that's why the need has arisen, and that's the reason it's been split into a thoracic and vascular surgery. So what kind of surgeries we do? Actually, why I chose thoracic surgery is because I did my general surgery from Gangaram Hospital. We had a very good exposure to laparoscopy. I mean, laparoscopy was my love. So I always wanted to continue my laparoscopic skills further. And I also wanted to be in a very niche field. And that made me decide, okay, I'll go to thoracic surgery. And thoracic surgery, there is advanced surgery called VATS, video assisted thoracoscopy. There's like laparoscopic is where you do it in the abdomen, and the same thing if you do it in the thorax, it's called VATS, video assisted thoracoscopy. So the scope is very high. The kind of surgeries like now the robotic surgery is also upcoming. The robotic surgeries. And the major surgeries, what we do is decortication. The bread and butter is decortication. Then mediastinal tumors, lung tumors. We also deal with esophagus, then thymomas, and all kind of mediastinal tumors, and all tracheal surgeries. So we do even tracheal dissection, anastomosis, tracheal tumors, and we also do thyroid, ectopic parathyroid. So these are the major bulk of thyroid surgeries. And all this, most of the surgeries can be done by minimally invasive and open method. So this is how thoracic surgery is. And if you see, I mean, I'll just finish the hospital part also. There are only 5 hospitals which provide thoracic surgery in India. So there'll be no confusion. I mean, there is no MCH or DNB. There's only DNB is present for thoracic surgery. So you don't need to get confused. There is no bond in any of the institutes. And is all the rules are as per the NB guidelines for DNB. So coming to the institutes, we have one is in Delhi we have 3 institutes. One is Gangaram, second is Medanta, and third is NITRD, National TB Research Institute in Mehruli. Then the other fourth institute is Narayana Hridyalaya in Bangalore. Then you have a LPS Cardiac Institute in Kanpur in Uttar Pradesh. And this year I've seen the seat matrix. In Jammu also they have started exclusive thoracic surgery. They are providing 2 seats. So in Gangaram you have 2 seats. In Medanta you have 3 seats. Uh, John Purushottam asked fees. Fees is standard. It's I think 1.2 lakhs per year. That's a DNB fees. That's a standard DNB fees. It comes around to 1.25 lakhs per year. So you have in Gangaram, you have 2 seats, Medanta 3 seats. Then in NITRD, you have 2 seats. Then Narayana Hridyalaya, you have 1 seat. So these are the 4 major institutes which provide thoracic surgery. The other 2 institutes, like in Kanpur, they have 1 single seat, and Jammu, they have started 2 seats. They are actually a cardiac surgery unit. They also do thoracic cases. Uh, so this is the thing. Then coming to the scope, I mean, coming to the various institutes in Gangaram, we do all kinds of cases. We approximately do 25 to 30 cases a month. We do all kind of variety of cases. We do VATS, we do open, and rarely we do robotic also. And regarding lung transplant, if someone wants to know about lung transplant, we are starting the transplantation. We have not started. I mean, we are about to start in 1 or 2 months. We have already made all the arrangements. So in 1 or 2 months, we'll be starting lung transplant also in the Gangaram Hospital. Then coming to Medanta, Medanta is also a premier institute. They have a lot of consultants that they do approximately 80 to 100 cases per month. They have the maximum numbers in the country. And then the next is NIT RD. NIT RD, they do approximately 15 to 20 cases. That's a government institute. Here, the limitation is actually the number of students. Actually, here, I mean, you have a lot of patients there. You can do n number of cases. The problem is you don't get time to do the cases. That's all. But here in NIT RD, the most of the cases they do are only benign. They deal only tuberculosis. The most majority of cases they do is decortication, thoracoplasty, and rarely they do VATS. Then Narayana Hridyalaya, they also that is also a very good institute. They approximately do 15 to 20 cases per month. They also have a wide variety, and you also have a decent hands-on in that institute also. And if you don't get any of these institutes, these for 4 institutes, and if you still want to take thoracic surgery, then I will advise either Kanpur or Jammu it can be taken. Any doubts? So Medanta was Gangaram. I've already told you the pros and cons of Medanta and Gangaram. Medanta, you have good numbers. In Gangaram, the main advantage is actually the mentorship is good. I mean, and you have very good hands-on in Gangaram Hospital. In Medanta, you'll have a variety of cases. You'll be exposed to variety of cases, but you'll be a second assistant. And I mean, hands-on is. I'm not telling it's zero, but you will get, but it's not as much as Gangaram. But definitely, it's a premier institute. Medanta is a premier institute. They also do lung transplant. They have already done 18 lung transplant in this one. Then the advantage, some people also would want to tell that, okay, I will join CTVS and then come to thoracic. There are actually already the existing many thoracic surgeons that actually have done cardiac surgery and then they have done thoracic. The main advantage for them is the CPB actually. So whenever a thoracic surgeon is stuck, whenever he damages the pulmonary artery or anything, then he should know and he must know a CPB or he must have a very good close friend or a cardiac surgeon with him if he's stuck in this. So the advantage of doing cardiac surgery is this: whenever you're stuck, at least you'll be able to control, you'll be able to cannulate, you can do the CPB. That is the main advantage of doing cardiac surgery. Also, in recent times, in lung transplant, also a person who has done cardiac surgery and coming to transplant, he have a additional advantage, I will tell. But you can, I mean, if you want to gain that skills, you can definitely do that. If you can finish your thoracic surgery, then you can go to a cardiac surgeon. If you learn basic CPB, and then you can also learn those skills. It is not like you can't learn, but it is some important cardiac surgery steps are important even for a thoracic surgeon. So anyone can actually unmute yourself and ask doubt. How is CTVS at Gangaram? CTVS in Gangaram is actually only a six-year course. They have it post MBBS. So you don't have a 3-year course in CTVS in Gangaram Hospital. It's all 6-year course. So post MBBS, they do it. You have only thoracic surgery in Gangaram Hospital. That is only, and you have 2 seats in Gangaram Hospital. Anyone else who wants to ask any doubt? I think Saurabh, we can continue if no one is asking any doubt. Yeah. Thank you.
Okay. Thank you, Dr. Sham. That was that was really good information on thoracic surgery. So coming back to cardiac surgery, uh, anybody has any doubts regarding cardiac surgery? So I am doing my cardiac surgery final year. I'm in final year in cardiac surgery in KM Hospital, Mumbai. So as you know, the KM is one of the most premier institute for cardiac surgery. Preferences for institute in Mumbai and Delhi, and what to choose between hands-on and exposure. Okay, so let me start with the later question: exposure versus hands-on. So even if there is 100 cases that are going on in one OT, Do you think you'll be able to attend all? I don't think so. So I would rather go for hands-on rather than um, exposure, because at the end of the day you have to learn, and there is only a few things that you can learn at a given point of time. So I would rather recommend, going for a better hands-on college than a better exposure college. I'll just give you a brief example. Many of you know about UN Mehta. So one of the most premier institutes in India for cardiac surgery. The amount of cases it handles on a daily basis is extremely high. Like they have around 15 to 20 OTs going on at a single point of time. So the exposure is really high, the case variety is really high. But if you're not going to get even like a stenotomy or cannulation or going on pump, even in your third year, then is it really worth useful for going for such colleges, which will give you a lot of it's like your entire you have an entire buffet of food, but you can't eat. Whereas you home cook food, which you can eat properly. So this is the difference. So I don't want to name any colleges per se, that I don't want to badmouth any colleges. It's just that what I have been seeing along with my colleagues in different hospitals, that is what it is. So colleges in Mumbai, I think the second thing I would like to talk about colleges in Mumbai is, first of all, hands-on. When it comes to hands-on, the two best institute, I think, Akshay is also with me. He's from JJ. Is Akshay here in the group? Akshay, can you unmute? Okay, so Akshay is also in third year. He's my colleague from JJ, and I'm from KM. So we both joined together, and we get the highest number of hands-on per se. Primarily because the number of seats that our batch had was really less, and secondly, the consultants. So in Mumbai, private practice is allowed. So okay, Grant Mumbai is so it's basically JJ. So since the consultants are allowed to have a private practice in Mumbai itself after being a part of government college, so their quota of doing uh, fair share of work outside is filled. So as a resident, that's all you need. You're getting a lot of cases hands on per se. So cases per se is, what you can do is in JJ and KM. I can talk for KM well. Is primarily the work is divided. Like for example, a first year. For example, take a case of say mitral valve replacement. So first year will go in wash up, do sternotomy, and yeah, depending upon if his work is completed or no, he can wait for the case or he can dewash. Second year will come in, he'll wash up, he'll go on pump, he'll cannulate, he'll go on pump. And the third year will come in and he'll do the mitral valve replacement. So it's a very structured kind of thing. So that is
Saurav,
how
I
you.
have just unmuted myself.
Oh, okay, okay. Yes, Akshay, can you hear me?
Yeah, yeah,
Yeah,
you
yeah.
can continue.
Yeah. So it's more like, you get the right amount of work at the right amount of exposure at the right amount of time. So as a first year, what is expected of me is, okay, in the OT, I want, maximum number of sonotomies to be done by me, so that moving on to the next step, I am more, sure about the cannulation. Then once you master cannulation, then you can move forward and, you can go and pump, and after that you can do the case. So it's a very structured approach that we have. KM versus JJ, which exposure is better? I think both of us have done enough number of cases, I think, me and Akshay. uh, so in my first year itself, so exclusively ASD, for example, is a first year case. So my bosses have, then second year may you get all your mitral valve replacements. Third year you get all your proximal distal CABGs and so on and so forth. So it's a structured kind of thing. Every hospital will have a different approach to surgeries, but I can vouch for my hospital saying, for KM, I can also talk in terms of JJ that, the amount of exposure that you get is really, really, really high. Secondly, coming to the bond, yes, we have a bond, we have a 2 years bond, but it's like, it's a blessing in disguise, I feel. Because in your SSMO ship, that is your 2 years of bond, the amount of exposure you get, the amount of, hands on practice that you get is really high. So, first of all, if it's a bonded hospital, all right, your salary might be say 15 to 20,000 lesser than your those who have gone out through the same year. But at the end of the day, you gaining so much experience is itself a big point. And like Vinayak sir said, MMC is excellent. Moving on,
Hey
toxicity.
guys, so
KEM.
just adding to the thing, the JJ versus KM debate, couple of private techs also. I think both of them are equally good. I have interacted with both Saurabh and Akshay, and I don't think there is much to choose between both these places. I think it depends on which part of Bombay you want to stay in, is what I would personally say. But yes, I will leave it to Akshay to talk about that. Yeah. Yeah, and just talking about MMC, I think MMC is also a fantastic place. I did my general surgery over there. Obviously, I'm not a CTVS surgeon, I'm a pediatric surgeon. But MMC, the amount of case, the caseload is excellent. The exposure is excellent. You get a wide variety of thoracic and cardiac cases. But you don't do vascular because the vascular surgery department is also pretty good. Yes. Hey, so Saurabh and Akshay, I think you guys can continue. Sorry.
So, thanks, Saurav. I'm Dr. Akshay Kumar Verma. I'm a final year senior resident from Grand Medical College and JJ Hospital. So first question which I saw in the comment box was which college you have to choose among exposure and hands-on. Without any doubt, go for a college where you have a better hands-on because at the end of the day, you should count the number of cases you have done at the end of your residency rather than seeing the complex surgery. Because in complex surgery, you will be a fourth assistant. But if you're not allowed to do a surgery, if you're not allowed to touch the heart, you would never ever know the situation, the emergency situation, and how to deal with the heart. So you should get an exposure in terms of CVS department. Secondly, I would say choose a college where you would find all the three branches cardiac, vascular, and thoracic. You should choose a college where you would get hands in thoracic and vascular also along with cardiac because a good vascular surgeon only becomes a good cardiac surgeon. Take it as a note of a Bible. Thirdly, choose a college where the number of residents are less. Obviously, that will increase your workload. It will be more hectic, but definitely at the end of the day, you would be knowing much more than that of the colleges where the number of residents are high and the cutting exposure is less. Fourthly, I would say choose a college, go personally to a college if you're opting for it on a personal basis. Don't just be in your room and just talk to the residents. How is this called? How is that called? Because every college will be pitching for their own department. It's good or it's bad. I mean, obviously they won't be saying the con and the bad points of the college. They would obviously highlighting all the good points. So you should go to the college, see the department, see the ask to the resident, talk to their lectures, what are the amount of cutting and all. Then only you will get a proper picture because it should not be that once you join because I know very good friend who have joined one of the premier institute of our country which feels the at the earliest position and he's regretting till date because I won't name the college. You people are smart enough to know the college which is it. Till date he's regretting because the number of cutting is very low there. Yes, you will be exposed to a variety of cases in that colleges, but the hands-on is very poor. And if someone says by observation you will learn the surgery, that's totally false and fake because unless and until you don't feel the heart, you don't know how to take a posting, you can't learn it up. Without observation, you can't be a good surgeon. You have to be good at your hands rather than being good in observation. Regarding cutting, uh, KM and CVTS in KM and CVTS in JJ both are equivalent, equally good. There are pros and cons in both the colleges. I will rather talk about the pros and then I will describe the cons of my colleges also. Pro is that you will get cutting right from the very first day. There's a structure pattern what Saurav tells in every CVTS department. Like you will be getting hysterectomy posting within 6 months, and ASD mitral are generally done by first year and second year. By first year, you will at least know how the steps of MVR and ASD because you will be asked to do it. AVR you would get in second year. Lima harvesting also in second year and proximal distal by the end of first year your if you're good at hands work and sincere, if you're confident in your cutting skill, you will even get proximal and distal. My juniors have got proximal and distal both by the end of first year. Lima harvesting, they have not received. One resident have received, another two has not received. So that totally depends upon your cutting skills and your confidence. If you're good, sir will give you. If you are not good, your bosses are not going to give you up. And thirdly, I would, and most important, if you're very passionate about CVTS, then only come and choose CVTS. Don't take it as a second option, because you will keep regretting it throughout your life. Because there are people who take CVTS because they don't have an option, and after that they start regretting it up. So if you're really passionate about CVTS, then only come and join the college. Rest, the cons, academic over here is average. No, there's no like we don't have an academic day, something like that. But if you are eager to do some seminar or journal presentation, there's a Friday we used to have academics on that day. So you can tell that, so I want to do a case presentation. Everyone will be allotted with something or the other topic, and then we can start the presentation. Generally, there is one or two presentation in once in a month, and definitely your bosses will support you for all the article presentation, paper presentation, be it national or international. Recently I have done a paper presentation in Abu Dhabi, and for in August I'm going for Singapore for Asiatic Society of Vascular Surgery. So there will be people who will be encouraging you for academic purpose only, but academics is still, I would say, it's average. I won't say it's very good over here. You have to study by your own at the end of the day. And yeah, we don't have VATs over here. In thoracic, you will get decortication, you will get lobectomy, you will get pneumectomy. Decortication you can get in first year. Lobectomy, pneumectomy, I think you will get in third year only, not before that. Elosier flap procedure you will get in first year. Thoracotomy, opening and closing, you will learn in very first year, and you have to give standby to the spine surgeries that is being operated in orthopedic and neurosurgery. In vascular, you will get AV fistula creation, and then AV fistula takedown, pseudoaneurysm excision, aortobiponal bypass grafting, femoropopliteal. Any vascular repair, you will start getting from the very first day. And senior generally doesn't go for this vascular case. It's being done by the resident only, especially by the first and second year resident. Even third year doesn't go to vascular emergency cases. In terms of vas cardiac, I've already told MVR ASD is totally a first year case. And in second year, you will get aortic and lima harvesting, proximal distal, in at the junction of the first and the second year. And skin to skin CABG, you can expect by third year. There are juniors who have done skin to skin CBG even in first year, but that's you have to be very, very sincere and very, very confident in your work. Then only you're going to get it up. Till now, only one first year has done it. I did around 5 to 6 CABG in my second year. Both MVR and MVR I have done around 13 or 14, and AVR is around 8. ASD is also 6. And rest vascular, you would get infinite number of chances, and you will get pro to it by the end of first year, and even in thoracotomy. Rest, the most toughest part is lima harvesting, which you will get. Which you will start getting second year, and I think by it will take around 3, 4, 5 months to get pro into it. So by third year, you can expect to harvest lima at a good pace. And going on bypass, you should learn by within 6 months. There's no escape. Each and every resident should know how to go on bypass within 6 months. Otherwise, you will be screwed for that in your OT days. Unless there is no toxicity, yes, at times your working hour will be hectic, so you have to deal with it and deal it with it. And regarding emergency, we have alternate day emergency. Plus, you will be provided with BPMT students who will help you out for all the blood drawing, dressing, even monitoring of the patient. So it's a pretty good college. I mean, I could say that you won't regret it at the end of the day. And if you're talking about Mumbai, DM and JJ, that's the two options I would always pitch for it. Other than that, I won't. Other colleges are also good. Nair and Sain are also good, but I would say there is more cons, and you should prefer these two colleges over other two colleges. Over to Saurav.
Okay, so thank you, Akshay. That was really good. I think you won't make a mistake in choosing any of the two, JJ or KM. The other two, I think the hands-on is lesser because it's more of, Cyan and Cooper. The amount of hands-on you get is quite less as compared to JJ and KM. So KM again, the advantage, as I can tell you, is far and beyond. Number one, your work-life balance is excellent when it comes to KM. So agreed. I mean, if you're in CVTS, the amount of hard work that you have to put in is a lot. So basically, if I have to put it in my way, it is you work hard and you play hard in KM. So when it comes to Mumbai KM, it's always, it's like your consultants will help you out with everything, and more or less, there is nil toxicity. Like if in my first year there were 6 seats, and me and my colleague, only two of us had joined. But right from my second year to my final year, were present to help me out with it. Coming to second point, which I really like about KM, is the work-life balance. So the work-life balance is so good when it comes to KM. Is you have your own personal time. I'll just give an example. So in KM right now, I am on vacation. So in my 10 days of vacation, that we get summer vacation and winter vacation. So I am in my summer vacation right now, and I'll just show you where I am. I am. Can you see my screen?
It's
I,
beautiful.
yeah, I am in Bali right now, enjoying my summer vacation, summer break. So yes, this is it, man. I mean, you get your personal days off. You have your set number of 10 days off. Other than that, other than the fact that you can get weekly offs as well, and you are here, you work hard and you play hard, you enjoy hard. So that is the whole funda behind it. Your HOD is excellent. I mean, I've not seen a better head of the department when it comes to uh, KM, and his calm, composed nature. He won't shout at you at all. So that's how it goes. So if you're planning for something like I'm ready to put in a lot of efforts. At the same time, I want my personal time for my family. So that's a good thing. Coming to what about Delhi institutes? Okay, Delhi institutes. I don't want to badmouth anything about anybody, or it's better you talk to the residents there. But what I have heard from my colleagues is you have a really high stipend. You have again, Shivangi, Ames Delhi. You have a really high stipend. The cases are good. You get a Ames degree at the end of the day if you're planning for Ames. But again, the hands-on which you'll get may not be sufficient as as compared to somebody from the other hospitals like Mumbai hospitals. Of course, I mean, like, it's one of the most premier institutes. You will get all and every case that is you know in your curriculum. But what is the will you be able to do those cases as third assistant, as fourth assistant? Yes, but hands on maybe, may not be. So it's better you personally visit those hospitals, and do not talk to the immediate seniors, do not talk to the second years, because they will tell you that this college is excellent, or you get a lot of hands on. No, talk to the third years, talk to the SSMOs, because then and then you'll get a real idea of whether this college, because third years and your SSMOs, they don't care if first years come or no. They are getting their work done, so they'll tell you the reality of it. Your second years, your immediate seniors will be like, they will butter things up and tell you how good this hospital be. At the end of the day, that's not wrong. They want juniors, they want you guys to join. So okay, BJ Ahmedabad, total number of seats are very high. Like there are around 18, 20 more than that number of seats. There's a vast exposure that you can get. So the amount of cases that you'll get is really high when it comes to BJ Ahmedabad. Then there's a lot of toxicity, if I'm not wrong. I don't want to talk about it, but there is a lot of toxicity when it comes to BJ. Even Jaideva, I've heard, one of my friends is in Jaideva. It's a really good hospital for academics, if I'm not wrong. So they'll cover a lot of topics. They will have academic sessions. Even KM has a dedicated academic session every Saturday. We have 10 to 1 o'clock academic sessions every Saturday, come what may. Next is what about BJ Ahmedabad that is done? VMMC or GB again. Delhi colleges high rate of high stipend, no bond. That's another good thing, no bond, and cutting is so. I mean, you may get some cases depending upon your consultant's mood. You may not. What about CMC Vellore? I'm not sure about CMC Vellore. I'm so sorry. You get a lot of vascular exposure there, is what I've been told. Like, but other than that, I'm not very sure. What is bond status in Mumbai? Where they place us is same hospital or periphery. Bond status currently is 2 years. It may be reduced to 1 year in the coming few months. It's a may or may not. I'm not going to comment and say that okay, it is going to happen. It is not going to happen. But at the end of the day, it may or may not happen. But honestly speaking, the bond is the best thing that can happen to you at this point of time, because first, job security. Secondly, is as a SSMO or your bonded associate professor, the amount of work that you get hands on is really, really, really high. So that is really good. Stipend in Mumbai, stipend in Mumbai is around 1 lakh rupees, as compared to Delhi, which is around 125 to 130 for the same year. And 1 lakh rupees is on paper. After TDS, you get around 90,000 in hand. So that is in Mumbai, and bonded again around the same lines. Next, okay, so regarding colleges in South, I would rather recommend you to, number one, make a list of colleges according to your preference, with say the fee structure, the bond structure, the cutting levels, the toxicity, and the work-life balance. So if it fits in all that category, that is what you should target in each of the colleges in the South. Can you give a general priority for CVTS colleges all over India? Priority, according to me, will be different than according to what anybody else is. So, for example, if I want more of thoracic, I'd rather go to Dr. Sham instead of coming to something like hospitals in Maharashtra or Gujarat, because thoracic cases are different when it comes to being in CVTS, whereas being in exclusive thoracic. So first of all, target what you want to do, whether in the moving forward you want to do cardiac, whether you want to do thoracic, or whether you want to do vascular. So depending upon that, I think you should make your next move. After you choose one of the three, your next step is, like I said, uh, coming to what is your goal. So whether you want more of academics, whether you want more of exposure, more hands-on, or a better work-life balance, and what about salary? So these all things you should target at the end of the day. Make a chart. That's what I did. Make a chart of things which I want and of things which the college is providing us with. So if you make a chart of that, you'll have a clearer idea of, okay, this is the target which I want. And of course, you have to take your rank in consideration also. I mean, it's not wishes and wants at the end of the day. So, what you can get. Like, for example, if your rank is way behind, beggars can't be choosers. So, you have to deal with what you get. And coming to next
One more thing
question.
which I want to add in thoracic surgery is, I mean, unfortunately, how endoscopy has been lost from the general surgeons and the surgical gastro people. Uh, Bronchoscopy is actually, thoracic surgeons have a very good scope in bronchoscopy. I always believe that a surgeon can be a good clinician and also operate. So a further scope, like if you can do an EBUS, that is endobronchial ultrasound, EBUS biopsies, you can. I mean, there are a lot of thoracic surgeons who completely do all bronchoscopy procedures by themselves. So that can also be a lot of scope in thoracic surgery. In recent times, even you have a robotic bronchoscopies also, which is coming. I mean, not in India, but the scope is still there. I mean, it will come sooner or later in India too. So the scope in thoracic surgery, exclusive thoracic surgery, is very wide. I mean, it's quite vast. I mean, you don't think that I'm doing a very narrow field. It's a very vast field where you can improve your skills. Definitely, the learning curve is high, not as high as maybe cardiac surgery, but it is high. You need a lot of training to before you become an independent surgeon. And there are a lot of even foreign fellowships all over the world. If you see Shanghai, they do maximum cases. In Shanghai thoracic, Shanghai Hospital, General Hospital, they do almost exclusive thoracic surgery. They do 200 cases per day. Then you have Singapore, US. I mean, a lot of other countries which they do exclusive thoracic surgery. It's a beautiful field. I mean, if you if you love laparoscopy, definitely thoracic surgery, you will enjoy it.
One thing I'd like to add in this is if you're planning to do, say, something like a transplant, so you should also target hospitals which have done transplants before. For example, there are a good number of DNB colleges which have done cardiac transplants. There are a good number of colleges which have exposure to transplants. For example, us, we've like I said, like last time when we had this talk, I'm sure Vinayak sir and Dr. Sham, remember this. I told the entire group saying, we will be doing a transplant next year. And we did a transplant this year. So, for a government hospital to be doing a transplant is a big thing. And this is just the start. We will be continuing transplants in KM further. And so is St. GS College and KM Hospital same? Yes, it's the same. It's the college and the hospital. So yes, transplants is one good thing which has happened to us. So this year, I hope we get back to doing a lot of VATs, because yes, we want to do VATs moving forward as well. And yes, I mean, are there any more questions which I'd like to answer with Vinayak sir's permission? What about colleges in Tamil Nadu? Like I said, South colleges. I think it's best you talk to the residents there, make a list of what you exactly want out of those colleges, and then go for it, because
I want to answer this question. Completion of course, scope, job prospects, and starting earning. I mean, this totally depends on person to person, I will tell. If a person is very confident enough to operate, he's learned all his skills well, and if he can communicate well, be in the private sector, then obviously these earnings will shoot up. I mean, it is totally individual basis. If you can go there and achieve, definitely you'll be doing it.
Yeah, we will try to have someone who can shed some light on South Institutes as well. I'll try to bring in Dr. Ajay Narasimhan also, who is a cardiac surgeon in Chennai, thoracic surgeon. He's done his CTVS from Madras Medical College. I'll try to bring him on board maybe tomorrow or day after. Hey, so just answering a couple of people asked about the bond. Like I think Saurabh mentioned earlier, at super specialty level, the bond is often a very useful thing because once you finish your MCH, you're itching to go and operate. And if you have taken a MCH in a state where you want to be there, okay, for example, if I was in Chennai and if someone gave me a bond, unfortunately, I'm in Jaipur and I don't have a bond here, but they've offered me a post, but unfortunately, because of family reasons, I can't stay over here. So that's a different story. But if you have an opportunity to do a bond in a busy institute, I think you are very lucky because your salary is going to be decent, one. Number two, you get to operate quite a bit. And as an early career surgeon, operating a huge number of cases is going to be a priority. And in fact, one of the big disadvantages of DRNB, I would say, the advantage is that there is no bond. But the disadvantage also is that there is no bond because a lot of people want to work in the same institution, operate more, and learn more. Because, obviously, once your exams are over, you are in a much better position to, absorb knowledge and, do better surgery. So, yeah. Hey, sorry for interrupting you guys. Continue.
Okay, any more questions, guys?
Then one more thing which I want to discuss, you should also, I mean, the question which every resident should ask is about research also. How
Oh, yeah.
they'll be exposed to research, how much publications, whether the co-peer group, will they be in research thing. In that way, I'll tell we are quite blessed. Our boss, Dr. Sabyasachi Bal, he encourages us to do research. Already I have 4 publications in after coming to Gangaram, just in 1.5 year span. So, I mean, that again depends on person to person, like how the kind of, you need to seek those opportunities whenever it is offered to you. Please list the thoracic places in order of priority. I mean, I wouldn't tell it is order of priority. Order of priority is different for different people. For example, a person who's in South, he would prefer Nanya Dela, prefer person who's there in North would prefer a Delhi Institute. But definitely, the advantage, you can just need to do the pros and cons for every institute. Okay, what will I get from that institute? For example, Gangara, again, I would always put Gangaram, Medanta in the higher end, then Narayana Hridayalaya, then NIT, RD maybe. Again, this is totally depends on the individual basis. For example, in NIT, RD, the hands-on is, exceptional hands-on you get. The pay is also more. You get, it's a government salary. It's like, I think 1.4 or 1.5 lakhs per month. The salary is good. But you get to see only selected kind of cases. You get to see benign cases. You don't get to see other advanced VATS surgeries. You don't get to see other robotic surgeries. But here, that is the advantage where you, in Gangaram or Medanta or Narayana, you will be exposed to these advanced surgeries too. And you'll be able to do it. For example, I have done a VATS decortication. I have done a lobectomy also. You'll be able to do, I have done steps of VATS lobectomy, not a complete lobectomy, but my senior, she has completely done VATS lobectomy in, she has done a VATS lobectomy and then she passed out. So that kind of advantages in each institute you have, which you need to discuss and then do it. Jammu, it's actually, they have just started this is the first year, this is the first batch which they are starting. And that's a complete cardiac unit. They are not, they are not doing exclusive thoracic. It's a complete cardiac unit. But now, it's in the initial basis. So you just you need to really consider before taking Jammu. If that is the last choice, then okay, then you go for Jammu. LPS also is a cardiac surgery unit. They have decent numbers. They have 10 to 15 cases. Again, because it's again dominated by cardiac surgeons, they do majority of the cases they do only open surgeries. They don't do VATS. So this is a disadvantage of LPS Nagpur. LPS Kanpur. And but okay, in the end, if you get only that institute, again, beggars can't be choosers. If you get it, then you can take it. And then there is always scope to learn further after you finish the course.
Guys, I think
I will sign off. I think
yeah.
I've had a lot of discussions.
Okay, so
And depending on each
what we
institute,
can
I
do
think
is
you need to call each and every person, then you
yeah.
have to decide
So
further.
Saurabh, Akshay, and Shyam are all there in the group. I think you guys can contact them to have an idea about it. I must thank Saurabh especially because he's in the middle of his holiday, but yet he volunteered himself to guide students. I think that's pretty commendable. Thank you, Akshay. Thank you, Shyam. So guys, have a great day. I'm sure you will make a fantastic choice and have a fulfilling super specialty journey. Thank you so much.
Thank you.
Thank you, Vinayak sir. It was wonderful
Yeah.
talking to everybody once again, and I hope you guys make the best choice. Again, as usual, nice talking to you, Vinayak sir. Dr. Sham, all the best for your exams as
Thank you,
well.
sir. Thank you. All the best, sir. All the best to you, sir.
Yes, all the best.
Thank you.
Chalo, I'll see you guys.
Yeah, sure.
Okay, bye bye.
Thank you.